pounds. So over to you, Mr. Ransom. I hand over the platform to you completely.
Okay, thank you very much. I think we've had very excellent presentations today, and we've talked about malaria, we've talked about mental health, and I think that we have to observe that even the World Health Organization have given some facts as far as the universal health coverage is concerned. And one of the first facts that I would want to state is that more than half of the world's population still do not have full coverage to essential health services, and more than that is more than 930 million people still spend, that is approximately 12% of the population in the world, they still spend more than 10% of their household budgets on healthcare. And we have more than 100 million people who are still being pushed into poverty, that is extreme poverty, living on less than $1.09 or even less on a daily basis because they have to take care of their health. And now the countries, that is all the member states of the United Nations, they have agreed that they want to achieve universal health coverage by 2030 as part of the United Nations Sustainable Development Goals. The question we want to discuss about in our open debate is the active role that we as youths are playing in enabling or in assisting our countries to achieve this universal health coverage by 2030. Before we actually begin, I would like to re-emphasize that we should observe order. If you have a question or if you want to make that is a contribution, simply raise your hand and simply try to go straight to the point. We have 1 hour, 30 minutes for this, so we should be organized so that we can actually achieve the objectives that we have. So with that, the floor is open. If you have any contribution as far as youths are concerned, that is in playing an active role in achieving universal health coverage, you can simply raise your hand. I'm waiting for everyone to contribute.
Ransom, I think you can check the chat section. There are some interesting things popping up.
Okay. To begin with what is going on in the chat section, I see, is it Miranda? Miranda has something to say. I don't know if this is related to the open debate, but I would just like to read it. And she's saying that, yes, those in communities can, however, I believe, I believe, I don't really understand, but they should use what they are affordable with. Okay, she's talking about malaria, and I think she's still talking about recommendations on how people can actually be able to not only know that malaria is there, but to actually prevent themselves from malaria, which is very important. Still looking at to see if, okay, I think there is a hand up, and that is, yeah, we have a speaker from Benin. Okay, please, you can unmute yourself and you can speak.
Okay, thank you, Mr. Ransom. First of all, I would like to thank each and everyone who presented something today. I really listened to each presentation with great interest, and I'm quite happy that to see the zeal everyone has towards achieving universal health coverage in Africa. However, I wasn't really satisfied because, since these past years, different trends have come up, and one of them is the rise of the healthcare costs. I don't know if you ever heard about it. And this rise of healthcare costs actually made people, I think that in Africa, we don't really see it that way, but if I have to address it this way in Africa, we can realize that most often the rural communities in Africa don't really have access to healthcare, rather because maybe the healthcare, I've said the hospital are far, maybe from the center or for other reasons. And if I leave that the rise of the healthcare costs recently realized, we have also the social perception that the food we consume, okay, defines our health. So if we continue that way, you can realize that those two trends, as example, led to a demand for food with some asserted health benefits. You understand me? So meaning that right now people focus more on the consumption on any value added food to address health issues instead of going to hospital. But unfortunately, since the beginning of this webinar, I haven't really heard uh, any presentation with an emphasis of the use of food as a tool to achieve universal health coverage. So my question is, how how could food be used to achieve universal health coverage?
Okay, thank you very much. I think that you raised a very important point, and we have health experts in the house. However, we were not able to have as many presentations as possible because we allocated time for this. I don't know who is going to start with answering this question, but everyone can answer. It's not only those who presented, but this is an open question, and everyone has the opportunity to contribute to this.
Okay, I'm listening.
Uh, Mr. Ada, do you want to comment on this, or Ms. Adarada?
Um, it's a really sensitive topic because I think we really we really did not include the aspect of food rather, and like it is popularly said, you are what you eat actually. So if we're talking about universal health coverage, which is health for all, I'm meant to believe that if we can adjust our dietary components, if we can adjust the way we eat, it will boost up our immune system to be able to naturally fight certain diseases on their own without necessarily consuming drugs or without taking some of those drugs. And the good thing about Africa in particular is that we have much of the natural food. We have much of the natural herbs and natural food. We don't have so much processed food in most African countries, which is an added benefit if we should maintain or we should follow strictly that kind of dietary composition. So yes, food has a lot to do with achieving universal health coverage, a lot to do with achieving universal health coverage. Because if we are trying to look for a way where everybody, when I mean everybody can access quality healthcare, it doesn't necessarily mean going to the hospital to be able to achieve that kind of improved health system. If you can sit at home and improve your own kind of food that you eat and boost up your own immune system, then it's going to be achieving universal health coverage for all of us. And also, one important thing that it was said was there is a there is a question that is in the air right now. COVID-19 came, it hit Africa, true, but there is a question of why are there lesser mortality cases in Africa? Why are less people in Africa dying, even though Africa was hit by COVID-19, even though they said Africa had a fragile health system, Africa had the weakest health system, but we are recording lesser numbers of mortality cases. And somebody correctly said in one of his articles that maybe it's because of the food we eat. In Africa, we consume natural foods a lot, not processed food. So maybe it has given us an extra boost, it has given our immune system an extra boost to be able to naturally fight COVID so that the mortality cases are less in Africa. So it brings us back to the same thing. Food is a key in achieving universal health coverage. So that is my own knowledge about food, though. I don't know much about the science of
We have two other hands up, and I think we're going to begin with that is Mafo from Cameroon, please. Can you unmute yourself?
Yes. According to, I just want to add to what Cynthia said because she just elaborated on my idea, and I want to say to add the economic aspect of the food. Like economically, if we produce more food, we can sell more food, and that is boosting our economy. And then we see how we can have finances to finance our healthcare. That is just a point I wanted to add to what Cynthia said when it comes to food.
Okay, thank you very much for your contribution. We also have, that is Ngo from Cameroon. Uh, you can unmute yourself, please. Okay.
All right. Thank you, everyone. Thank you for the presentation that was done before. I had some problems with connection and power. Yeah, but concerning food, when you talk of food, it goes back to agriculture. And Africa, we are blessed and endowed. Africa has 60% of the world's arable land, and which shows the potential that Africa has. But it is very unfortunate that most of the aid in the world is coming from other countries that they don't instead have arable land. This is, I think, for us to attain a universal health coverage, which Africa should first of all believe in their own method. We should try to develop Africa by Africans' way, in the Africans' way. Africa should develop by method of its own. And agriculture, I think, is a very good platform. Because one great man, I think, let me call his name, Dangote of Nigeria, he was asked, what is the future? He said the future is agriculture and ICT. Yeah, because people will eat until the world ends. That is, I think that is a good ground that Africa can pick from and attain universal health coverage. Because before, we used to think diseases like cancer, high blood hypertension were mostly diseases from the West before. But now it is gradually entering our own society because we have changed lifestyles. We think that maybe in taking lifestyles from the West, the way they behave, the way they eat, you see, is gradually bringing in some of those diseases that were not common in African setting. So I think even we improve our food and our diet is going to help to improve our immunity and also make us strong. And health is a precondition now for development. Health now is no more a byproduct of development. It is a precondition. And for us to for us to attain that level, we need to be healthy by eating good food. As it is said, we are what we eat. Thank you.
Thank you very much. Your contribution is quite good. We're going to move to Eno Bless, who also has a contribution to make. I think, Bless, you can unmute yourself. Okay.
Okay, thank you. Thank you very much once more for giving me the floor to talk. With respect to our discussion topic, I think youths have a lot to play when it comes to not just universal health coverage, but a lot of things when it comes to nation building and progress or development. Especially in the context of this webinar, we've had youths, or let me say all of us are youths that have a certain academic background, or we are involved in research one way or the other towards achieving a universal health coverage. And just to begin with the question, the first person, somebody asked a question on how it affects the economy. There's a concept in health. I don't know if it's public health or it's just everywhere, but they call it DALYS, DALYS. I can't really remember what it means. It's been long I used it, but it's a system in which you calculate. For example, let me illustrate a story. A child who is supposed to go to school doesn't go to school because, say, the child got cholera. Now, that child did not go to school for 2 days because he got cholera. The child is at home. That child sleeps on the bed in the hospital, occupies space on the hospital, which is government money. That child takes drugs that was supposed to be used for maybe for in more serious cases. That child is absent in school and doesn't use certain government resources that have been put in place to educate them. That child has missed a certain lesson that could have helped him, or that child didn't is using some of the money their parents are supposed to use to make food in the house and all that. So there are certain ways in which you calculate that, and when you convert all those losses, all the morbidity, you convert it to money, it translates to millions of dollars at the level of the country when you do that for everybody. So the country loses millions because of that. when you do that at a larger scale. So to come back to what we as youths can do to achieve this, we as researchers, we have to be conscious of the fact that the information that we get is information that can be used to better the lives of others. And unfortunately, in Cameroon, we have this issue where you don't really look at the role that postgraduates can play in informing policies, for example. Because I am from there, so I know how the library in UB looks like, very big with abandoned theses there that is being covered by dust, and a lot of those theses are not published. And when they are not published, almost everybody forgets what's been done. And one of the reasons too is that the work that the most of the works that are carried out are not statistically sound, or cannot be defended at an international scale. You can't really use it to inform policies because the methods are a bit weak. So also, we as a user should be conscious of the fact that we need to know the right methods to use for our work, and we need to know the policies that are available, or the kind of policy, the kind of improvement we can make to the system. We need to involve ourselves more in those talks. If you don't, you'll be doing research that cannot lead to any innovation, cannot solve any problem, cannot help anyone in society, and of course, nobody even ends up seeing what you're doing. So we should know the right methods, we should know the right ways, and the robust methods to use in our work to profit from our data at a at the maximal level, so that we can contribute with our research. And we already talked about volunteerism, and we should also be context aware of our. We can't. I think something like witchcraft, which has been mentioned there, we shouldn't. We as scientists, yes, it's witchcraft. It's science. It's just that a lot of science can't really prove what's going on, but it doesn't mean it doesn't exist. It does exist. Science proves a lot of stuff, but witchcraft, I think one of those things but there's something like metaphysics that explains some of these things. Now, we can't just go to a community and say, oh, this is not witchcraft, this is not witchcraft, or this is science, we can't prove it. No, we have to come up with innovative ways in which we can approach the communities and school them on some of these things that these changes that we want to see in the community, in order to have a sustainable change, because they will tell their children tomorrow and their children will tell their children. So if we can't come up with innovative and sustainable ways, then it's going to be a problem for us. Thank you.
Okay, thank you very much. I just want to say again that the topic for our debate is we are looking at the active role that youths are playing in achieving universal health coverage. Please, if you've raised your hand, keep your hand raised. You're going to have the opportunity to talk. Everyone is going to talk. And those who had questions, like those who had questions in the chat section regarding some of the presentations that we had, you can also ask the questions now, and the floor will be given to the presenters to answer your questions. So I'm going to the next, that is the next person we have here. I don't know, Ileri from Nigeria. If I'm pronouncing the name well, I don't know.
Oh yeah, it's Ileri from Nigeria.
Okay, super. It's your turn.
Okay, so I just want to add to what you guys have talked about today. You guys mentioned about the government, the NGO, the roles and their roles in the community health, right? But what I have always thought about is that we don't have to talk about the community, the rural areas only. Okay, there are places that even developed in Africa, but people are ignorant. People don't have the knowledge on how to take care of their health. We as the youth, we have more access to social media, right? We know how it is going in the world. We just don't use our social media to just take pictures and post and all that. We can use this to educate people. We can use this to educate people on their health, on how to take care of their health. When you're sick, you go to the hospital, because I've seen so many people, when they're sick, they just stay at home and take some help. They don't go to the hospital. So I think we can educate people in the community, not only people in the rural community, even people in the town, people that are even educated, they went to school, but they don't know the right thing to do. So we can try to educate them, to make them know what they're supposed to do whenever they are sick. This can also help them. And someone mentioned about food. Yeah, food is very important. Like because most diseases, most diseases are due to like lifestyle changes, right? Maybe diabetes, hypertension. They might be due to genetics, and also food also has a lot to do with them. So when we go to the hospitals, I want like tell people, especially those in the health sectors, that when patients come to you for diabetes, hypertension, you just don't prescribe drugs to them. Because last year I did my observationship in Nigeria, and I realized that when patients come with these diseases, doctors forget to mention to them about their lifestyle changes, which is very important. If you are diabetic, you should know what food to eat. If you're hypertensive, you should know what food to eat. You just don't take medicine and think you'll be okay. You have to correct your lifestyle. I think that's all I have to say. I just want to start, like, to summarize it. We need to educate people. We need to.
Thank you. I think that is a marvelous contribution. So I think this is part of the education that we're already doing, and we have to continue in this light because it's kind of what we call health activism. So we have to continue in this light to make sure that we do not only use the social media that we have before us,
Exactly.
actually a very good tool, maybe for social life, but we use to educate people when it comes to health. Please, everyone who has raised their hand, keep your hand up. Let me go to the chat section for a moment. We have a question from Asonga Fak, and I would want to read the question so that we don't miss it in the course of the debate. So he's talking about, let me just read it as it is. Talking about mental health care coming from Cameroon, I believe there is a problem related to kids' mentality, as many children are emotionally neglected and their parents are not aware that they are impacting in their children traumatic experiences, making them to feel as such. So how can an NGO target such cases because there is no treatment to what they don't know? Thank you. I think this is a question directed to the presenters, and I would like to give the floor to Jamin because he's the one who did the presentation on mental health to throw more light on this. Jamin, are you there? Okay, if he's not available, not to waste time, please. Any other person who has an answer to this question can take the floor, please. Okay, if please, you can be thinking about answers to this question, then we're going to move to the next person.
Okay, Ransom.
Yes.
Okay, so just so we don't waste so much time, the person is talking about mental health and kids, right?
Exactly.
Okay, you know, children are sometimes, there's a saying that children are a product of what they see. Children are a product of the environment. Children are a product of what they hear. So there are so many things that NGOs can do. And I think this is also an important question because NGOs have kind of neglected this area, especially when it concerns kids and mental health, because a lot of them watch so many shows on television. There are a lot of video games out there that promotes gun violence. So all those things affect their mental. And there's also a saying that children have emotions. The way you raise your child, they have emotions. If you yell at them too much, you teach them that this is a certain manner in which they should behave, you're indirectly impacting on their mental health without you realizing it. Especially in Africa, where we so much believe in corporal discipline, you know, all these kinds of methods, it impacts on the child's mental health. So the first thing I can tell you as an individual is you have to watch what your parents, what kids watch. You have to monitor what they watch. With these days, you find kids who are so young and they have phones, they have tablets. You have no idea on which site they are logging into. You have no idea about the peer pressure also exists among kids. Where you go, maybe you find a child of 12 years, his fellow 12-year-old kid has a phone, and it begins to play on his mentality, like maybe my parents don't love me, my parents are not taking care of me because A has this and I don't have this. So it centered a lot around parental care, like Ransom has just stated, parental upbringing. You have to monitor those kids. You have to monitor what they watch, what the phones they have, what do they have on those phones? What do they watch on those phones? What do they spend their time doing? Who are they texting? Who are they listening to? You as the parent, how do you behave in front of your kid? You as a sibling to a kid, how do you behave in front of your kid? Do you help your siblings, or do you just expose them to just whatever? Mental health is very key, because as a child, the child's brain is still very, I like to use the word fresh and fertile. So whatever you deposit there grows very well. If you deposit hatred, it grows very well. If you deposit love, it grows very well. And there are so many programs, I think, that if you go to YouTube, there are so many helpful kids program that enables them, that helps them to learn. So in as much as the internet has a diverse range of things, there are so many helpful things on the internet too. So thank you for creating our awareness. I hope one of us here at the end of the day will be starting an NGO that is specified for kids with mental disabilities, because in the US and other developed countries, they are more developed, since most of them are suffering, most kids are suffering from such issues. So they have taken into consideration mental homes for kids and all those things. But in Africa, I don't want to say they don't exist, but I believe that most of us are not quick to identify them as a mental disorder when it comes to the child. So it's an eye opener. It's a call for reawakening, and we're hoping that one of us in here can take up the call after this and start something great and amazing. So
Okay.
thank you.
Thank you very much. So we have to focus on parental care. We have to focus on a good upbringing for our children, to make sure that, because this is also going to influence their health in the future, especially in terms of mental health. We have, I think the next person that I'm going to give the floor to is Landry. Landry, are you there?
Yeah, Mr. Hanson, thank you for calling me. I wanted to answer a question concerning the debate we opened. I will say quickly is that no, everyone here is involved in different fields. So everyone should think about what he can do according to his field. For example, I think that people already emphasized what I wanted to say by the fact that first people need to be re-educated. You understand me? For example, in Africa, we have many food, but people don't really know how they could miss the food. People don't really know how they could eat this and eat this, because of course it's good to eat food, but the truth also is that we have also that the concept of nutrigenomic, like what food says to our genes. You understand me? Meaning that we cannot really miss any kind of food that way. So people need to be um, re-educated about how they can eat, about how they can consume food. And actually, this is what we can use. We can use our different social media platform to, to get to more people. And why not, if we are in touch with some NGOs head, we can still find a way of how to maybe direct a program, in collaboration with them, how people can, where we can teach people how they take good care of themselves and through food. This is all what I wanted to add. Thank you.
Okay, thank you very much. I think you've also raised a very good point, because if you look at it from a micro perspective, you realize that we are all members of different families, and we are part of the process to making this happen. So it begins with us. We have to start by educating ourselves, educating our families. Then from there, we start educating our extended families. We go to communities, and that is how we educate everyone. So it is more or less something that if we must achieve it, then we must start from the individual level, then we go up to the collective level. The next person, I think we have Leslie from Cameroon. Please, you can go on. Leslie, are you there? Okay, if Leslie is not there, then I'm going to go back to the chat.
Can you get me now?
Yeah, okay, thank you.
Okay, can you get me?
Yes.
Okay, I'm Leslie from Cameroon. And I'm actually very privileged to be part of this very empowering session talking about USC. And I just want to go to the debate topic and raise my own concern as concern young people. And I want to say that, as we all know, the African population, especially in sub-Saharan Africa, is almost 60% made of young people, and that's a great human resource as concerns USC. And what I want to actually lay emphasis on is the fact that if we are talking about UHC, that's universal health coverage, and we are not talking about the issue of accessibility and affordability, then we are actually missing a cause. Yes. And when we're talking about making healthcare completely available to everybody, we are talking about making it accessible and affordable. How do we make sure that people in local communities are having access to healthcare, quality healthcare? How do we make sure that a mother who is in a local village somewhere in Cameroon can have access to health care facilities that are popularly in the urban area? And I want to say that young people in Africa have been trying to come up with very innovative solutions to make sure that they reach out to local communities and provide them access to healthcare, especially in this advent of using technology. I think they have used what we call digital healthcare to make sure that they leverage digital healthcare and provide access to quality healthcare to people in local communities. And in Cameroon here, when I want to talk, I will give an example of an innovation like the cardio that was designed by a young Cameroonian here that helped in carrying out cardiovascular tests in local communities and sending the results to a hospital in urban center so that it can be analyzed, and then somebody is diagnosed with a particular disease. And there are other young people around there who are also designing innovative solutions in that direction. So I would say that yes, there is no way that USC will be achieved if young people are not fully integrated. And as we talk, as we were discussing earlier, talking about volunteerism, yeah, volunteerism is a full part of it. But also, I want to insist on the fact that young people in Africa are using what we call innovative solutions to actually make sure that healthcare is accessible to people. They have always called us the Android generation, and we are using it positively in that direction. So they are making healthcare accessible to people in local communities and affordable to them using innovative solutions like the cardio that I just mentioned. And if you go to countries like Kenya, go to countries like Rwanda, go to countries like Nigeria, especially, they are very innovative in this direction of leveraging innovations, technology to make sure that uh, healthcare is accessible to people in local communities. So I would say that yes, young people have a big role to play, and they're actively playing that role. When we talk about integrated health organization, we're talking about a group of young people who have decided to take community health in their hands to make sure that they help communities grow, have access to healthcare, and they do this using innovative solutions, using the social media, using community outreach, and going down to communities to make sure that they preach preventive healthcare. And if uh, we can put those efforts together and reach out and talk about Africa, the impact they are creating in Africa, we see that young people are not only talking, but they're actively involved in the issues of providing access to healthcare to local communities and in urban areas.
Okay.
So yes, for me, it's a yes. Young people are doing a lot in providing access to healthcare, not just a lot, but also innovatively in Africa. Thank you very much.
Okay, thank you very much. We have a good number of hands up. But before we go to the next person, I would just like to say that please keep your answer short or keep your contribution short. If it is a question, just go straight to the point so that at least everyone should have the opportunity to say something. So I'm going to go to the next person, who is Tanya from Cameroon. I don't know who is from. Tanya, you can unmute yourself, please? Are you there? Okay, if you
I'm there. Are you getting me?
Yes, I can.
Yes, I'm there. Are you getting me?
Yes, I can.
Hello?
Go on.
Can you get me?
Yes, I can get you. You can go on, please.
Okay. Thank you very much for this wonderful opportunity. Tanya joining you from South Africa. Um Actually, I want to thank the host for such a wonderful initiative. First, we are talking about universal healthcare. And when we talk about universal healthcare, we are talking about the fact that all individuals and community receive healthcare service they need without suffering financial hardship. Yeah, so that is what we are talking about, how each and every individual can receive health service without suffering a financial hardship. And when we talk about the role of youth as far as universal healthcare is concerned, I can say the youth are actually playing their part in achieving universal healthcare. And if you look like the activities going on now, and some of the NGOs that are in Africa, you see that 80% are made up of youth. And when we talk of universal healthcare, we talk of health promotion to prevention, treatment, rehabilitation, and palliative care. And youth are playing a lot of role in promoting health. Obviously, actually, if you look at some of health organizations and NGOs and so on, you see that the youth are the one going taking the risks and taking the courage to go into the interior, yeah, to assess the communities to make sure that they really receive health care. Yeah, and they are doing that in the form of NGOs, not even through government organization. Yeah, and when we also talk of universal health care, the government also have a role to play, because we are talking of each and everyone receiving health care. So the government has a major role to play in this as compared to the youth even. Yeah, but I can say Africa got a long way to go in achieving universal health care, because the government is like, the contribution of the government towards this is not up to 50%. I can say, for instance, in Cameroon, I belongs to one NGO they call Doctors Without Borders.
Can
Yeah,
you?
that have been working closely. Hello.
Yes, try to keep your answer short so that others can also have the opportunity to.
Okay. I was saying that like in Cameroon, I belongs to one NGO, the Doctors Without Borders, and we have been working so hard in achieving universal care, especially during this crisis period, helping even those with mental health and so on. So just of recent, you see the government came with a communique to show that the activities of Doctors Without Borders has been suspended till further notice, that they need to like identify their action. But that is an organization that has been working so hard to make sure each and everyone receive health care despite the crisis, with little or no income being paid. So you see, the government is like, if we are talking of achieving universal health care, in the respect to the youth are playing their part, but in respect to the government need to come in play. If the government can't come into play, then we have a long way to go in order to achieve universal health care. Yeah. And I heard some of the presenter presenting, like Ms. Daga Miranda, like she made mention of the fact that there are no road, little or no road to access rural areas, and those are the people that really need health care. There are little or no road, and that is where the government have to come in play. And those people, even they have little or no health center, not to talk of drugs, not to talk of even first aid drugs. So the government really have more role to play in respect to universal health care than the youth. And the youth are actually playing their role. Thank you very much.
Okay, thank you very much for your contributions. Please keep your answer short to everyone who is going to have the opportunity next to speak. Then I also want to say that in as much as we have so many examples from Cameroon, we should understand that it is not all about Cameroon, it's about Africa. And I believe that Cameroon share a lot of similarities with other African countries. So whatever is happening in Cameroon in terms of universal health coverage is equally or can also be adapted to the other local realities that we have in other African countries. So I'm going to go to Cyril from Cameroon. Cyril, it's your turn. You can go on, please. Okay, if Cyril is not there, then I'm going to go to thing that is it. Cyril, are you there?
Can you hear me clearly?
Yes, I can hear you. You can go on, please.
Okay, thank you very much. Actually, my mic was disturbing earlier. Okay, thank you all for your brilliant presentations. My name is Cyril. I'm from Cameroon, but currently I reside in Istanbul. I'm a student of bioengineering. I would like to make mention of a current challenge that is preventing universal health coverage in Africa, and it's about vaccines. And what I know is that one of the major challenge in Africa is that there is current continuous outbreak of epidemics, diseases that come, spread and infect a lot of people and then they disappear. And a way to counter epidemics is by administration of vaccines. So a vaccine is meant to boost your immune system so that when an epidemic arises, your immune system is going to be able to fight the disease. But in Africa or in other places of the world, there are conspiracies going about saying that vaccines are bad. And unfortunately, many people believe these conspiracies. So when the time comes to take vaccines, when the time comes for administration of vaccines, many people refuse. They don't want to take those vaccines because they believe vaccines are bad. And others believe that a vaccine is a virus that is meant to infect them or kill them. And it's true, a vaccine can be a virus, but it's not meant to infect you. But because many people believe otherwise, they don't take those vaccines. So my question is, what measures can we take to convince these people that vaccines are not meant to kill them, but to help them uh, not to get infected by some epidemics? Thank you.
Okay, thank you very much. That is a very good question. I'm going to add this other question so that the answers can all come in a block. So there is this other important question from that is Usmanu, and the question has to do with African traditional systems. He has this to say: how can African traditional systems, such as the use of herbs and other ancient medicine, be optimized to improve our health system? I think this is also a very important question. Please, I want to beg on you all that if you want to give an answer, maximum is a minute so that we can be able to finish everything in time. Thank you.
Okay, can I answer this question?
Yes, you have the floor, Mr. Henry.
Okay, according to the African traditional system, what I can say quickly is that first we need to characterize these herbs. You understand me? Because most often we can find one herbs in Africa and they say that it treats, I don't know, 5, 10, or 7, more than 7 days. It's not possible. We need to know to characterize these herbs first, okay? And after we need to do an optimization of the extraction process, okay? Because generally in Africa, we extract all those bioactive compound hot, because generally there is two way of extraction, the hot way and the cold way. But the problem is that the hot way generally, okay, what we call infusion, you put it in hot water and whatever it is, leads more often to the development of all those advanced glycation end product that's also really dangerous and really difficult for our system. So what we have now to do is we have to find, okay, the right way to extract the molecule, the enzyme, or the bioactive compound, okay? And then why not? We can use an encapsulation method, okay? Maybe using stack to encapsulate them so that people can consume it. But now this is already a little bit sophisticated. I think that we need to work on right now is to find the right dosage. You understand me? For example, people are used to maybe drink 1 cup morning and evening, and they drink it maybe for 5 days. Okay, we need to know the quantity after how many days the person is able to be okay, to heal. We need to know the dosage because this is the most problem we have. Because sometimes, and also I think that we need to carry out more research to assess the effect of the long consumption of all those herbs on our health. This is also really important because I think that in Africa, we don't really focus on all those things. They are really important. A long consumption, a long time, long period consumption of this consumption, like this infusion, what is the effect on our health, especially our kidney? Because, all those herbs have a higher content of all those heavy metals and all those toxic compound. That's not really okay for our health. So to resume myself, we need to think about how to change the hot optimization. Okay, even if you have to do an hot optimization, maybe the temperature shouldn't cross the 70 degree because that is really important to extract. Or what we can do also is that after boiling, maybe the water, okay, we take the water down, we let the water cool down till 80 degree, and we then put the herbs on it. But like I said, the most important thing is to really make it functional is we need to know the dosage. I mean, what quantity people can eat. This will really improve and we make a good optimization. Okay, and we need also to think about the effect of the long consumption of this extract on our health. Thank you, Mr. Evans.
Thank you very much. You raised very important issues here. Believing that all of us here are in one way or the other students and practitioners, I believe that this is something that we should research into because we are not only here to talk and go back home, but we're here to talk and practice what we're talking about. That is one thing that we should keep in mind while in this webinar. So I'm going to, Ms. Ada, do you have any other thing to add to this question?
Yeah, just about the questions you asked.
I'm going to come to you. Just a minute, please.
Why a minute?
Okay, Ada, you can go on.
The question Cyril asked about how do we convince people about the benefits or the good points about vaccine. I think the last time we had the webinar, this came up, and I'm very happy it's coming up again because there are a lot of theories or whatever surrounding vaccines. Now, I will just tell you one thing. In everything, there are always rumors. In everything, there are always conspiracy theories. Vaccines are generally meant to protect us if they follow all the procedures. Phase 1, phase 2, phase 3, tested and proved that it's actually safe for human consumption. Now, in as much as people will do their best to spread what they believe is false, when vaccines come out, it's for our own benefit. So are you going to be the question you should be asking yourself, are you going to be one of those who will join social media in spreading the false rumors, or are you going to be one of those that will actually help people to know that vaccines are actually for their benefits after having done your own research and have the points that you want, like you're able to talk with concrete points that this vaccine is good. So there's always going to be that kind of theory, but trust me, when vaccines are tested and proven, the world is in a better place today because of vaccines. Polio is gone, so many diseases have been eradicated thanks to vaccines. So before you join the media is a very big tool. I cannot overemphasize how media has changed the way we see the world today, but vaccines are good if tested and proven scientifically. So I don't think there should be any problem in consuming a tested and safe vaccine. That's just all I have to say. Just do your research, get the facts from the right source, and know what to do. Thank you.
Okay, thank you very much, Ada. I'm going to give one last opportunity to, that is Tanyi. Tanyi from South Africa. You can go on, please.
Yeah, thank you very much for this another opportunity. Firstly, I would just want to throw just one word in respect to the vaccine. Actually, there are two goals for vaccine, effective and safety. They work, they are mutually related. For a good vaccine must be effective and it must be safe. If a vaccine is effective and it is not safe, then it's not a good vaccine. And likewise, if it is safe and it's not effective, it's not a good vaccine. So if you see like some people are all advocating, they are not advocating as if they don't want vaccine. They are advocating for a safe vaccine, yeah, because we all know vaccine, they got a very good vital role to play in respect to our immunity. So it's good that we have like what Miss Ada just said, we should do our own research. It's very important to do research. And there are some criteria of people that require vaccine, while there are some others that don't require vaccine, like especially those who are really immunocompromised. They have their own level, yeah, of treatment that they require. So you should do research, find your place, find your position, yeah, where you belong, yeah, and know what is necessary for you. And the part I also like is vaccine should be voluntary. Yeah, yeah. So if it's voluntary, like you enable you to choose what you want. Yeah, actually, yeah. Because we are all talking about the safety, yeah, of a vaccine. Thank you very much.
Okay, thank you very much. So vaccines are very important and they are supposed to be safe and effective. So we should do our research and make sure that if vaccines are for our own benefit, then we should take them. So we have some contributions in the chat section. The first contribution is from Jamin, and he's talking about the role of young people in achieving universal health coverage. And he is saying that the role is very important. And he's talking about the example of this webinar, where he says that the average age, that is approximately, that we have here should be 26, which clearly shows that a cohort of young people interested in universal health coverage can be very important in achieving the objectives of this program. So we are a huge resource in actually helping to achieve universal health coverage in Africa. Then the other contribution is from Leslie, and he's talking about universal health coverage basically being in the hands of the young people. So young people are not only carrying out interventions, but they are also advocating for improvement of healthcare policies. So these are very important points that we should note. And I think that should be all for the open debate. We're now going to go to
Ransom, before we conclude, I don't know if I can add something with the question on traditional medicine. My
okay,
connection is quite disturbing, and
the
I
floor.
happen to lose all the chats.
Okay,
So I cannot really recall what his question was all about. But I just want,
traditional health systems.
yes.
Okay, the question was about that is the importance, the use of traditional health systems like herbs in actually promoting healthcare in Africa, because maybe what I understood is that maybe we have overemphasized the drugs and all that, forgetting that we also have things like herbs that can actually help in improving health. So what is the importance of the traditional health system in helping to improve health in Africa?
Okay. All right. Thank you so much. I think it's a very good question, and especially in our setting, African setting. I don't know if you can get me.
Yes, we are getting you. You can go on,
All
please.
right. I think there are so many advantages. I can just name some few, like for presently with the advent of this COVID-19 here in Cameroon, there have been so many traditional drugs that came up, and let me not lie, some of them are like I cannot judge, I cannot really like give a definite answer, but I can give my point of view. There are some traditional herbs that really help for this. When you have when you have a flu, I don't know if it treats COVID-19, but when you have a flu, I know you can eat ginger, you can boil it with limes and some kind of mixture, and it works. It works for me. So for me, traditional medicine is really important. Because it's quite accessible, it's affordable, and it's more like directed to a particular culture. It's more of
if us here in Cameroon, we can easily use this traditional medicine to cure certain a targeted disease, but maybe for someone out or someone abroad, it might be a little bit complicated. It might not work for the person. So African traditional medicine can work in that way. But my only concern with with traditional medicine is, first of all, the how can I say, the dosage. We don't know how the prescription. It does not have a fixed prescription on how to consume the drugs. And then the second problem is also the hygienic method in which we even do this we even produce these drugs. Do we actually respect all the hygienic methods? Do we have like a correct diagnosis on the drugs we are taking? There's this lack of complete code of conduct in taking out in consuming this traditional medicine, even though they might be good for certain people, for some people. But we need to take into to consideration all this. There is also a lot of, how can I say, there's inefficient control in the market, because the it came up the traditional, how can
Right.
I say, the mixture of drugs.
Hello.
Hello.
Yeah, please just summarize everything in 1 minute, please.
All right. To get to cut it short, for me, African tradition is quite good, and a lot of we need to put in more effort in order to make it to be more impactful. Like, we need to go in for increase the training. Those who are already into this setting, they can train the practitioner on how to make these drugs. These drugs were consuming in the local, were producing in the local way. They can train these local producers in order to, how can I put it, in order to make it more, how can I say, I'm really in pressure now and I'm trying to conclude.
Thank you. Thank you very much for your contribution. I think we've had an excellent debate, and just to add up to what that is Manuela was saying, I think it follows up with the argument that Landry had concerning traditional African medicine. And the problem is not that these African herbs do not work. The problem is that we have not actually done enough research into this to be able to know what quantity that we can actually take when we have them, or even how to process it and who to administer to. So this is a big challenge to us who are here today to take this up as some kind of research. I believe that we have a lot of people here who have the